In this talk, we will discuss the direct intervention techniques used in the practice of physical therapy. To begin, categories of direct interventions are highlighted in this slide. These include therapeutic exercise, functional training, manual techniques, use of various devices and equipment to enhance function, airway cleaning techniques, and integumentary repair and protection techniques. As well, the use of electrotherapeutic modalities and other physical agents and modalities are frequently used to decrease pain, decrease inflammation, and to promote healing. As you can see, therapeutic exercise is listed first, and is listed first for a reason. Therapeutic exercise is the foundation of every rehabilitation program. Of all the interventions used in physical therapy, this is the primary intervention. Exercise can improve strength and endurance and counteract the effects of abnormal stresses, such as the muscle atrophy that occurs with prolonged bed rest. Therapeutic exercise goals aim to restore normal function, prevent injury, educate the patient of how to prevent recurrence of injury, and to help maintain normal function. Therapeutic exercise for strength training can include the use of body weight as resistance, and also the use of equipment such as weights and exercise bands. Sophisticated equipment may also be used, but it is not necessary. In other words, you can develop a very good exercise program with little equipment. Now let's look at each intervention category in more depth. With respect to therapeutic exercise, there are categories of exercise that we will now examine. First, we will discuss range of motion exercises, or as we abbreviate them, ROM. There are three types of range of motion exercises: active range of motion, passive range of motion, and active assistive range of motion. Active range of motion is defined as motion produced voluntarily by the patient. Passive range of motion is defined as motion produced by the examiner with no assistance from the patient. Active assistive range of motion is range of motion in which the patient tries to produce motion voluntarily but is assisted by the therapist or machinery. In this slide, we see a woman performing active range of motion of the ankle. Here she's doing what is called dorsiflexion, where she is bringing her toes towards her chin. She is doing this through voluntary motion. The next motion is ankle inversion. This is where she is turning her ankle in. The next motion is ankle eversion. Here she turns her ankle out. And finally, we have plantar flexion, where she points her toes down. These are all examples of active range of motion exercises at the ankle. Here we have an example of a therapist performing passive range of motion. Here she's doing ankle dorsiflexion and plantar flexion, and the therapist is producing all the motion. And finally, we have an example of active assistive range of motion, where this woman is helping her affected arm, her left arm, using her right arm. Now let's look at another category of therapeutic exercise, resistive exercise. These include isometric, isotonic, and isokinetic exercise. Isometric exercise is defined as a muscle contraction without visible joint movement. An example would be contracting your quadricep muscle without moving your knee. Isotonic exercise is defined as a muscle contraction that produces or controls joint motion, and it comes in two categories, concentric and eccentric. A concentric muscle contraction results in muscle shortening, while an eccentric muscle contraction results in muscle lengthening. Well, what does this mean? Well, let's look at a biceps curl. Let's use this video example to explain the differences. Here we will see a woman performing a biceps curl. When she raises the weight to her shoulders, the bicep muscle is contracting and shortening. This is a concentric contraction. When she lowers the weight from her shoulders, the biceps is still controlling the motion, only in this case the muscle fibers are lengthening, thus an eccentric contraction. So that's concentric when she pulls it towards her chin, eccentric when she lowers the bar. Concentric, eccentric. And finally, let's look at isokinetic exercise, which is defined as exercise that produces a muscle contraction that occurs at a constant velocity or speed. Let's use another video to examine this. Here you see a woman strapped to a machine for exercise. The lever that is attached to her leg only moves when she moves her leg. In other words, her muscle action moves the lever arm. The machine can be set at various speeds, 60 degrees per second for example, so the resistance exercise occurs only when the person attempts to move the lever at a faster rate than it is set for. For example, if the arm of the machine was set to travel no faster than 60 degrees per second, if she tries to move faster than this, she will feel resistance, as the arm's arc of motion can be no greater than 60 degrees per second. Let's watch. An analogy that is similar but not exact, that may help with this concept, is that of moving in water. Imagine you are standing neck deep in a pool, your arms out in front of you. You begin to move your arms back and forth very slowly. There is little resistance to your motion when you move slowly. Then you try to speed up your motions, and you begin to realize the faster you move, the more resistance you feel. This is similar to the feeling with isokinetic training. I encourage you to try using one of these machines when you are in the clinic to get a greater understanding of this concept. These resistance exercises I have described are used to increase muscle strength and endurance. It is important to know the concepts of muscle strength and endurance to guide treatment. Muscle strength is defined as the maximum amount of tension in one repetition. Exercise parameters to improve strength would include a lower number of repetitions with the use of heavier resistance. For example, a program of 5 repetitions per set for 3 sets with 30 pounds would be an example of an exercise program to improve bicep muscle strength. Endurance, on the other hand, is defined as the ability to produce and sustain tension over a prolonged period. Therefore, exercise parameters to improve muscle endurance would include a higher number of repetitions with lower resistance. For example, a program of 30 repetitions per set for 3 sets with 3 pounds would be an example of an exercise program to improve bicep muscle endurance. These fundamental concepts regarding low repetitions with high resistance for strength training and high repetitions with low resistance for endurance training must be well understood to care for patients properly. Here we see examples of therapeutic exercise for resistance training. Here we see a TheraBand, or a rubber band for lack of a better term, used as resistance, and we see one here. In this picture we see weights used for resistance. Here we see examples of therapeutic exercise to strengthen the core or the trunk muscles. Up here we see the plank position. Here we see the quadruped position. Here we see seated on a ball exercise, and here we see bridging. These are all classic exercise used for trunk control. Resistance exercise can also be performed in an open kinematic chain or in a closed kinematic chain. Well, what exactly does this mean? Well, an open chain exercise is an exercise in which the end limb segment is free to move in space. The example in your slide of a biceps curl illustrates an open chain exercise. In this case, motion is isolated to the elbow, and the biceps is performing concentric and eccentric contractions as described previously. In other words, only one joint is moving, the elbow joint, and muscles on only one side of the joint, in this case the biceps, are contracting. A closed chain exercise, on the other hand, is an exercise in which movement at one joint affects movement at other joints. The distal segment is fixed and cannot move. The example in your slide is a push-up. The distal segment being the hands. They're attached to the floor and cannot move. In the open chain example, the hand is free to move in space. Now let's go back to the push-up. Again, here the hand, or the distal segment, is fixed to the ground. In order for the individual to flex the elbow and perform a push-up, the shoulder and the wrist joints must also move. In addition, the muscles on both sides of the joint, for example the biceps and triceps, contract in controlling the joint motions. Contraction occurs on both sides of the joint, and this enhances joint stability. So, with open chain exercises, muscle strengthening occurs on one side of the joint and movement is isolated to that one particular joint. These are good for targeting specific muscles for strengthening. With closed chain exercises, motion at one joint will produce motion at another joint, and muscle contractions occur simultaneously on both sides of the joint. These exercises are good for targeting groups of muscles and also in protecting joints, as less joint translation occurs with closed chain exercises. Now let's look at three remaining categories of therapeutic exercise. They include flexibility, balance and coordination, and cardiovascular endurance. Let's look at flexibility. The goal of flexibility exercises is to increase range of motion. Conditions causing decreased flexibility, such as those which occur with prolonged immobilization or trauma, require attention. Soft tissue can change length or adapt over time with stress, and there are a variety of techniques used to improve flexibility. In the top slide, you see an individual stretching their hamstring muscles. Balance exercise is another category of exercise and is a vital component of almost all rehabilitation programs. If you will recall from our previous discussion of the proprioceptive system, the joints have mechanoreceptors that feed information to the brain concerning joint angle, or the awareness of position and movement in space. These are often damaged, as in the case of ligament injury with an ankle sprain, and the mechanism requires retraining. Balance exercises help restore Here we see a patient performing a balance exercise on a Bosu ball. This is a higher level balance exercise as the supporting surface is uneven. This type of exercise helps restore proprioception and balance. Cardiovascular endurance is yet another therapeutic exercise intervention used to improve cardiovascular function. Patient types that benefit from cardiovascular training include those with compromised cardiovascular systems, such as those who have had coronary artery bypass graft surgery. As well, individuals trying to return to work after injury benefit, as do athletes trying to return to competition.